Hello, my name is Lynette, and I will be talking about gestational diabetes mellitus, gestational diabetes, or GDM for short. Gestational diabetes is a form of diabetes the mother has only while she is pregnant, and it affects about 3 to 8% of all pregnant women in the United States.
There are hormones in the placenta that block the body from being able to use insulin properly. Glucose levels will increase in the blood and will be carried to the fetus instead of being absorbed by target cells to be converted into energy. In a normal pregnancy, the pancreas will secrete more insulin to counteract the insulin resistance that the hormones in the placenta creates. However, in a GDM pregnancy, the extra insulin secretion is insufficient and the patient is insulin resistant. Gestational diabetes usually develops around the 24th week of pregnancy, so the patient will probably be tested between 24 and 28 weeks gestation.
The signs and symptoms of GDM are frequent urination, excess thirst. One second. Also, losing weight with no explanation and itching. However, these are also common signs of pregnancy. When it's time to start testing for GDM, first there will be a glucose screening test. The patient will drink a sugary liquid and the lab will take a sample of her blood after 1 hour. If the blood glucose level is greater than or equal to 140, the patient has failed and will move on to the glucose tolerance test. The glucose tolerance test is another blood test, but they will take your fasting sugar levels first, and then the patient will drink the sugary liquid, and then the blood will be drawn and tested at 1, 2, and 3 hours after drinking the liquid. The numbers the patient has to meet can be different depending on what guidelines the provider is using. I have a chart here of those different guidelines. If the 3-hour tolerance test is failed, then the patient will most likely be diagnosed officially with gestational diabetes. The patient will first be referred to a dietitian or a diabetes specialist. The first line of management will be maintaining a healthy, balanced diet, eating small portions every 2 to 3 hours, 3 meals a day, and 3 snacks a day. Along with a healthy, balanced diet, it is also recommended to get 30 minutes of light exercise a day, such as a brisk walk, some pregnancy-safe cardio or light weights, or maybe even a little bowling. While the patient is maintaining a healthy, balanced diet and exercising at least 30 minutes a day, they will need to check their blood sugar levels with an at-home monitor at least 4 times a day. The first number the patient will take is a fasting number when they first wake up. The number should be less than 95. Then 2 hours after a meal, it should be less than 120. Some providers also want 1 hour after a meal, and that should be less than 140. So it has been 2 hours since my delicious meal that I had. So now it's time to test my blood sugars. So I'm just gonna take you through a little bit of what I do when I do that. First thing I do is I go and I wash my hands. And then I have this lancing device. I call it a lancet launcher because it launches the lancet into my finger. This here is the lancet. You just stick it in there, take off the end here, and put the end on there. All right, so that's ready to go. Now I put the testing strip into my monitor here. and that's when the monitor turns on, at least for me. And then even though I washed my hands, I'm still going to get an alcohol swab and find a finger that's not sore from previous finger prickings. This one here is not sore, so I'm just going to kind of go over the whole tip of the finger here with an alcohol swab. And I'm going to wipe off the alcohol so that maybe it doesn't affect the sugar readings here. Oops. And then I just kind of find a good spot that is not sore, and I press down a little bit hard, and I press the button, and it launches the lancet into my finger. And as you can see, it's bleeding there. So I'm gonna just kind of wipe off this first little bit of blood and get a little more and put it on the reader here. And we'll see what the glucose monitor says. And it says 84. And so 2 hours after a meal needs to be less than 120. If maintaining a healthy, balanced diet and exercise does not help keep the blood sugars down, the patient's provider will most likely use one of these 3 medications to help. The first one is gluburide, the second one is metformin, and the third is insulin injections.
The prognosis and potential health problems with GDM for the mother are requiring a cesarean section, requiring to be induced early, preeclampsia, premature labor, cardiac issues, risk of having GDM in the future pregnancy, risk of developing type 2 diabetes later in life. The prognosis and potential health problems for the baby is that the baby could be large, baby is jaundiced due to low blood sugar, stillbirth, needing to be on oxygen after birth, risk of obesity in childhood, and risk of developing diabetes in childhood.
Thank you for watching this video. I hope it helps you understand gestational diabetes mellitus a little bit better. Have a wonderful day.